Hi, my name is Mary Keeper, and I'm the owner of Kenai Peninsula Mental Health, a local private practice here on the peninsula that specializes in youth and family counseling. In this video today, we're going to talk a little bit about the brain, specifically the brain of a child who is melting down. Now, obviously, this conversation is far more complex, and there's lots of different information that we could get into. But for the purposes of our video, we're going to keep it real simple. Children, God bless them, are a delight and a joy. And sometimes they're not. You know what I'm talking about. There are moments where they're amazing. They're adorable and sweet and funny and thoughtful and relatively rational and overall quite awesome. And then there are moments where they're melting down, where they're throwing themselves on the floor and screaming from the top of their lungs for no apparent reason other than the fact that you gave them Cheez-Its instead of goldfish. So what you need to know in this moment is that your child, just like each of us, is primarily operating out of two sections of their brain. To keep it simple, we're going to refer to this as the upstairs or the downstairs brain. So here's your visual aid. Hold up your hand, tuck your thumb across your palm, and fold your fingers over. This section of the brain right here, that's the upstairs brain. The downstairs brain is back here. So when your child is freaking out, for all intents and purposes, they have flipped their lid, they flipped out of that upstairs brain, and they flipped into their downstairs brain. Now, the upstairs brain is great. We're not going to spend a lot of time talking about it because typically if your child is in their upstairs brain, things are all good. The downstairs brain, however, is a little bit of a different story. So the downstairs brain serves a great purpose. It keeps us safe. It's in charge of our fight, freeze, flee responses, which are very primitive and actually were tremendously important when we were trying to avoid being dinner for a saber-toothed tiger back in the day. However, in this day and age, operating out of this part of your brain is pretty problematic. And when your child is melting down, that's the part of the brain that they're in. When it comes to effective communication with your child, if they're in their downstairs brain, good luck. It's not going to happen. All of their energy and resources is going towards some variation of that fight, freeze, flee response. So if you want to effectively communicate with your child, they have to be in their upstairs brain. Fear not. The first step in getting your child out of their downstairs brain into their upstairs brain is simply recognizing where they're at. So well done, you. So stay tuned for my next video where we're going to discuss specifics on how to actually help your child move from that reactive downstairs brain into their more rational, calm, thoughtful upstairs brain. Thanks for watching. This is Mary Keeper with Kenai Peninsula Mental Health.